Welcome to HCA Talks Health. I'm Zina Leroux, and with me today is Dr. Caroline Gibson. So Dr. Caroline is a lifestyle medicine doctor. She's also a health coach, and it really is a privilege to have you on our show today, Caroline. Welcome.
Thank you very much for having me, Zina. It's lovely to be here.
Yeah. So you're a GP with a lot of experience, so it's like more than 20 years experience, am I right?
Yeah, that's right. Yeah, I've been working in the NHS for 20 years, yeah.
20 years, but you've also got extended roles in lifestyle medicine, if I understand correctly, and also health coaching.
Yes.
Yeah. So when you're working with patients, you cover a whole range of health factors in an integrative way, rather than just focusing on one specific niche. So I'm really interested about this approach, and maybe you can tell us a little bit more about how you go about.
Yeah. So I have, as you said, Zina, you got it right. I've got a range of different roles. I have a clinical practice that I work in a couple of days a week. And then the rest of my time, I'm working as a health coach and as a health coaching supervisor. So I've got at least 3 different distinct roles. So it is very much, I'm very aware of the essentially like the hat that I'm wearing on any one given day. So I really have to be very mindful and ground myself before I start a session. What is the role I'm doing today? What am I bringing to that session? And regardless of the role that I'm in, there's so much overlap, there's so much in common. For any sort of problem that is brought to me or any issue that we're sort of talking about, there is rarely one solution to it. People they'll come to me with a specific issue that they'd like to think about, that they'd like to discuss, but it's really very unusual that there is a single answer or an intervention or a treatment that will just address it and sort it out, because most things are multifactorial.
That's true.
So my approach, whatever role I'm working in, is I start by taking a step back to listen to the person that I'm working with, to look at the whole picture, all the factors that are contributing and what's brought them to me at that time. And that integrative approach just means to me is that I have lots of tools in my toolbox, and I can pull them out of my toolbox and use them for the person that I'm working with in front of me for the best fit for them. As a health coach, it really mirrors that integrative approach to health coaching really mirrors my original training, my medical training as a GP. All the GPs out there will know we have lots of medical tools in our toolbox, and we're very used to just pulling them out and using for the patient in front of us. And I kind of use that approach in my health coaching as well.
So it really depends on what this person needs, and what might work for one person might not work for the next one. So it's really about individualizing the solutions. So can we try to make it a bit more practical?
Of course.
And just by using an example. So let's say there's a patient coming into your office telling you maybe they've been feeling off for quite some time, their mood is low, they're really tired. Where do you even start?
Yeah. So actually feeling low and especially tired is one of the things that I see most often. My clinical work is mostly in post-COVID care for people with long COVID. And my approach to that is to start with a really thorough, holistic assessment, to take that step back, to look with a helicopter view of all the different aspects of their life, of what is happening for them. Depending on the person, it might be different tools. We might use something like a 24-hour recall of, tell me about your usual day. But then work through all the different pillars of lifestyle medicine, sort of exploring what is going on in each area in regards to their sleep, their nutrition, their stress levels, their relationships, their social connections, their, all the things that might be contributing to how they're feeling at the moment. So that's where I start. And then, as you can imagine, literally anything and everything can fall out of that. So And then it's a case of working through it with the person about what is important to them, what really matters to them, and which ones do they think that they could work on first? Where would they like to start?
And that's where the health coaching comes in. So really putting them in control of the journey, putting them in the driving seat. So thinking about lifestyle prescription. So what might some of the lifestyle medicine prescriptions be that you might give this client that's feeling a bit tired and their mood is low?
Yeah. So I'm not a big fan of that phrase, lifestyle medicine prescription. I know a lot of my colleagues are, but for me, a lifestyle medicine prescription is one that my patient or my coachee, my client, depending on which role I'm working in that day, but the lifestyle medicine prescription is one that they design for themselves. So my role is to share information with them, to have a look, if there's an area that they've identified as being most important, so physical activity, for example, I might share the evidence base with them to make sure they've got really good quality evidence-based information about what might help them, but then think about, well, actually, but how does this apply to you? What is manageable for you? What is realistic? What is possible? And then ask them to sort of create the steps to move forward from where they are at the moment to where they want to be.
I like that. So that's just coming back to putting them in the driving seat. So, so would you sometimes make a recommendation, or is it always about helping and supporting them to figure it out for themselves, what the next steps are that they need to take?
It depends on which role I've got, which hat I've got on that day, about how directive I am. I'm really mindful that if I'm coaching, I'm very much avoid being directive, because that's just not a coaching approach. When I'm more clinical, I might make some recommendations, but often the most powerful changes and the most powerful sort of plans are the ones that the patients make for themselves, because they have to want to do it. If they're to be able to be to feel in control, to be empowered to move forward. So as I say, it depends on which role I'm working in, but it really, even in my clinical role, using my coaching skills in clinical practice is really powerful and really effective. And I absolutely believe that any clinician working in almost any role can lift coaching skills into their clinical role and apply health coaching skills to their clinical practice. And I've seen time and time again that it is just so powerful, and patients benefit from it so much.
Can you please tell me more about that, because I'm really interested in how you combine the two roles. Is it mainly conversations that you have with them and then you turn it into a health coaching conversation? Tell me more about how they complement each other, the two different or more than two roles that you often are in.
So first for me is, as a practitioner, I need to be really clear about my scope of practice and what is the role that I'm doing that day. So when I'm in my clinical practice, people are coming to see me for a medical consultation, but using and integrating my coaching skills into that is really powerful. So it's not about turning it into a coaching session, because that's not what a patient's expecting. That it's not contracted for. They're there because they want to have a medical appointment. That's what they're expecting.
Yeah.
But by integrating and just dropping those tools in, to just using things like a really person-centered approach, shared decision making, those are key things in NHS practice. They're really what the NHS is aiming for, and those coaching skills help you to do that.
I like that. And shared decision making, and I guess it's also about managing expectations, sharing with your patients that it is about shared decision making, and I do want you to be able to sustain these changes that you're going to make. And you often see that when you choose it yourself, instead of it being a prescription, as you said earlier, it's often more sustainable. So I think that's really also important for the client or the patient to know that. It's probably going to be more effective if we do it in this way. So if you're thinking about how you typically set up some of the conversations or the recommendations that you make, are they mostly lifestyle related, or is there also a place for pharmaceuticals, let's say?
So in my medical practice, it is, again, in my medical practice, it's a very much a combined integrative approach that, just because I use coaching skill doesn't mean that I don't use traditional medicine as well. You can absolutely have both sitting alongside each other. It really is a sort of hand in glove kind of relationship. So I absolutely believe there's a place for pharmaceuticals, but it really does lean back into what we were just saying about shared decision making with the person that I'm working with. It is about giving them the information. These are the options for treatment. This is how effective they're likely to be. And that includes lifestyle medicine treatments. And then going through what would you like to have happen next? Which way is most appropriate to go first for you? So that was kind of a general approach from a clinical point of view.
Okay. So you do still give them a choice what line, what direction they want to go into. So let's just bring that back to our example that we've talked about earlier. So the patient feeling a little bit low, tired. What might some of the lifestyle shared decision making be to actually improve someone's mental health?
Yeah. So that I see those patients so often with the combination of fatigue, low mood, lots of different sort of problems. And when we sort of delve into it, it's usually totally multifactorial. There isn't a main cause. It's impossible to narrow it down. Modern life has just become so complicated. We are living in this really fragmented society with our highly processed food, lots of demands on our time for work and relationships and social life and caring responsibilities. We have this massively environment which is, we've got bright lights and devices, and our sleep is impacted as a result of that, and our circadian rhythms thrown out by shift work and long hours at work. There's just so much. Then you can add on the top of with that of any illnesses that they've had recently. For me in my COVID clinic, people have had COVID, and so those infections have had an effect as well, and any other illnesses and medications that they and medical conditions that they have. So I kind of map all this out and then look about, well, of these things, what are the things that you have some control over? It's about what are the things that are possible to change? Often that might be activity that you're doing, whether it's physical activity, cognitive activity, how much brain strain are you trying to engage with, emotional activity. It might be their sleep that's another common thing, and nutrition and stress levels. Those are the four main things that I often are usually amenable that somebody can make some modifications to.
But I guess, I don't know if you've experienced this as well, but I've seen many people who sometimes have a resistance against making lifestyle changes. They prefer some quick fix, to pop a pill and to solve it in a kind of easy, fixable way. So do you also experience that, or are there also people who have a resistance against lifestyle changes?
Absolutely. And I totally understand that. There were people, especially if you've been feeling so unwell for so long, that you what you want is to feel better, and you want that in the fastest way possible. So that is absolutely understandable, and to a certain extent it's very expected in because so many things we do have good solutions for, and modern medicine is amazing. Science is just amazing, and it's coming on so quickly. So yes, I do hear some resistance, but I think, and where I go with that is that it is about taking a step back and saying, well, we could go down this route if there is a route, because sometimes there isn't. And how realistic is that? Because it's about what is that person expecting from a specific treatment or medicine or tablet, because their expectations may not match with what it will actually achieve. And but then also looking at, well, what is it? Why is that fix important to you right now? What is your underlying reason for wanting to feel better? What's it really, what are your values? What makes this important to you? And how are you going to maintain that in the long run? Which is, because people, yes, they might want to feel better straight away, but they don't want to feel better straight away and then go back to feeling dreadful again. So having that conversation about, well, here's one option, but actually let's just take a look back about the reality of what's going to happen, and really exploring what is really important to you in the long run. What are your values? What are your hopes? And by the time you spent some time thinking about it, people do recognize that actually a long-term solution is probably better.
So do you think that the biggest barrier that people face when they're trying to adapt to a healthier lifestyle is that they're not connected to their why, or that they're not thinking about how I need to think about this in terms of sustainability, not quick fix. So do you think if that mindset is shifted, that often it can help them to move forward?
I think that's one of the barriers. So there are so many barriers. It's all about modern life and time pressures and lack of support. Support is so important. We are meant to exist in a community, in a tribe, but we've become really fragmented and just stretched for time. The number of things we are expected to do in 24 hours these days is just ridiculous. But we absolutely don't have to struggle alone. In any area of life, having community and social connections is a key pillar of well-being, and I could talk about that for days at a time, and I'd love to come back and talk about it some more. Just thinking about support, the Harvard study showed that the most important factor for longevity and well-being was having good social connections, and we know that people with good support are more likely to make those lifestyle changes. And it doesn't have to be professional support or coaching support, although obviously coaches are experts in doing this, but it could be peer support, it could be family, it could be friends, it could be a local community. Wherever your support comes from, that's so important with making those changes.
Fantastic. Yes, so I think it's about having that support, but also surrounding yourself with like-minded individuals. It's not that easy to make those changes if you're not on the same page than the people that you spend the most time with. So yeah, that's an important part. So if you're thinking about, just onto a bit of a different note, so thinking about any interesting trends or developments in healthcare, what are the things that excite you the most right now, maybe particularly in relation to lifestyle medicine?
Yeah. So I think for me, for lifestyle medicine, one of the most exciting trends is the development of health coaching in the NHS. Health coaching didn't exist. Well, it did exist, but there were very, very few of them scattered around in the NHS before 2020. But in 2020, health coaching became a funded role in primary care in the NHS in England. And that has just led to this explosion of health coaches. We now have about 1,500 coaches working in primary care in the NHS in England, and the NHS long-term plan is to increase that number at least threefold. I think they're aiming for almost 6,000 coaches over the next few years. And so when health coaches are ideally placed to support people to implement those lifestyle medicine changes. Lifestyle medicine clinicians are doing the excellent research of why does the lifestyle medicine changes work, what is the evidence base for them, but actually applying that and integrating it into practice, that's where health coaches really come into their strength, because it is how do we support people to make those changes and to integrate it. So for me, one of the most exciting things is the rise of health coaching with the NHS, because that makes it available to people who may not be able to afford it otherwise. And it brings it into the mainstream. It means that my colleagues, other medical professionals, are seeing health coaches. They're getting to know them. They're realizing how amazing they are and all the things that they can support with. So yeah, that's absolutely one of the most exciting things. And one of my work streams, one of my roles that I do is supervising health coaches in the NHS. And I just love that work. They are such a great bunch of people.
Yeah.
I love my supervision sessions with them. I always kind of come away with such great thinking on the back of those sessions. So,
Ooh, do tell us more. I'm really interested. So, is it more about supporting them when they're working with difficult clients, or what does the supervision process look like?
So supervision, it can look, the actual process can look different. We can have one-to-one supervision, we can have group supervision. But essentially it is a reflective space to spend some time thinking about your coaching practice. It's not just about difficult clients, although that is a really useful thing that we can do, that I can do as a supervisor. But I broadly think of it as, firstly, it is support for things that are tricky, whatever the coach wants to talk about. It's also, though, about helping coaches develop in their practice to be able to increase their knowledge, their skills, their competencies, to develop, their coaching skills, but also to develop their coaching careers. Where do they want to go next with it? And lastly, there is a bit about, quality assurance and are we coaching well? Coaches are very, very isolated. You're often working with you and your clients or your coachees. In the NHS, people are working in small teams or on their own, depending on the size of the area that they work in. But it is really isolating. So, that bit about, did I do this right? Having someone to bounce those ideas off and share best practice. Or I've got this scenario, what is the ethical thing to do here? So supervision is a space for that. So supervisors are not there to give the answers, absolutely. We are there to kind of facilitate that reflective practice. To help develop coaches to, help support coaches to develop and to be the best coaches that they can be.
Absolutely. And so it comes back to that support that you've mentioned earlier for our clients as well. They need support when making lifestyle changes. And the same applies to health professionals and practitioners. We also need support. And I've often discussed this with some of the students, saying that how important this is. Because when they're studying, they're used to being in groups, having these reflective practices. But once they graduated, it could be quite isolating. So I think having a group in which there's space for reflection and how to develop in your own practice, discuss difficulties, but also how can I be the best coach possible, I think is so useful and so needed.
Yes, absolutely. And it absolutely fits with the global code of ethics for coaches, specifies that coaches should be in supervision. And honestly, as for my personal experience, my supervision session, so I have my own supervisor, go to supervision once a month. It is the highlight of my month because I get to go and just empty my brain and bless him, he kind of just repacks it, reflects it all back, and it all just suddenly makes sense. It is magical.
The power of coaching, hey?
Indeed.
Oh, that's amazing. Okay, so yes, really how health coaching has become part of lifestyle medicine. It works together perfectly because yes, we need that level of education. We need the science. We need to see the research. This really works. But then we need someone to help us to implement it and to find out, but what's coming in the way for us? What's making it difficult for me to actually do the things that I know are good for me? So it's such a beautiful marriage, I think, between lifestyle medicine and coaching. So just thinking about everything that we've talked about so far, what would be some of the key takeaways, or maybe a bit of a summary that you really want our audience to remember from today's conversation?
Oh, we've covered so much. I think so some of the the key takeaways, I think I would summarize in that health coaching is absolutely a wonderful tool for supporting lifestyle medicine. They absolutely go together. I think health coaches it can be an independent intervention on its own. You know, patients go to see a health coach for a coaching session and are supported to make the changes that they want to change. But also, health coaching is such a powerful tool for clinicians to integrate and to use in their clinical practice. And that is something that all clinicians can do. And I think that is really key as well.
Mm.
And I think my other key takeaway is that actually support and community is so important, because as coaches we often do work in either on our own or in small groups. So having a like-minded community is, I think you said it beautifully earlier, that it's important for the people that we're coaching to have support in making the changes and moving forwards and working towards their goals. But it's also important for us as coaches to have that support in our coaching with a like-minded community. So that's my way. Thank you, Zena.
Yes. So as a clinician, it's so useful to bring coaching into your practice. It's it's going to change everything, but we also need the support as the practitioners. I think that's beautifully said. Thank you. Okay, and then finally, where can our listeners learn more about your work? If they maybe want to connect with you, how can they reach you?
Okay, so the best place to find me is in the LifeMed community. We're on Instagram, on Facebook, at LifeMed Community, or on our website, which is lifemedonline.com. We are an online community for health coaches, for all healthcare practitioners and doctors, anyone who is interested in lifestyle medicine, whether you are already practicing lifestyle medicine, whether you're a health coach, whether you've done a lifestyle medicine qualification, or you're just at the start of your life finding out about lifestyle medicine. Our mission is to bring lifestyle medicine to as many people as possible, because we know how important it is for all our patients, our coachees, and our belief is the best way to do that is to empower our members, our healthcare and health coaching community, to know more about it. So that is what we do.
Oh,
so you find us at Lifestyle Medicine, LifeMed Community. I do have my own website, which is at Dr. Caroline Gibson. That's very easy to remember. But I would be delighted to hear from people. I can talk about lifestyle medicine for a very long time.
You can see that you're passionate about this topic. And I just want to thank you. I just want to thank you for taking this time. You do have many different roles, so I'm sure that you are busy. So thank you so much for taking this time to share your insights with us today. It's really been inspiring to hear more about how you are helping people, and how you're helping them to take control of their health with this integrative approach. So I'm really sure that our listeners will walk away with plenty of practical ideas to consider. So thank you so much, and wishing you all the best in continuing this important work.
Thank you so much, Zena, and thank you so much for having me. It's been an absolute pleasure.
If you have a passion for health and wellness, and you would like to make a difference in the lives of others and discover a new rewarding career in health and wellbeing coaching, visit www.healthcoachesacademy.com to find out more.